we're finally getting into an open architecture mentality in health tech. We see it in robotics. You can't possibly solve all the challenges there, whether it's imaging, navigation. But when you think about training, solid training does a number of things. It makes the patient safer. Mm-hmm. It also drives procedures, because if I can train more surgeons to get to a higher level of competency, they'll use more instrumentation. And if I'm a surgical device company or I'm a robotic company, I don't know if my expertise is building training, right? So why wouldn't I, as a device manufacturer, support a simulation company or a number of simulation companies, not buy them, mm-hmm. right? Because it's to the advantage, the more information that you gather per training session on this gets aggregated to inform a database that then continues to level up the surgeons or the aspiring surgeons along the way, and raise everybody's game, and therefore inform device manufacturers as to techniques or even features on a device. So has that come to the conversation yet?
It has, and it's a really exciting piece actually, and that feeds a little bit back into that previous question of why hasn't it been fully adopted? What's been going on there? And we spoke about it being driven by the clinicians, so tradition, and is there something that's viable? The other thing is money. And because traditionally there hasn't been budgets to do this, because it's sort of been a nice to have, the financing of this technology is still not that mature versus the financing of medical device technology. And so the device companies actually are going to play a really important part in this for a number of reasons. One, for the piece that you mentioned there, which is improving their own technology, getting a huge amount of data from the training environment where no one was getting data before. And the great thing about this tech is you don't have to wrap little stickers around the end of the instruments. You don't have to put fiducial markers on. You stick any instrument you like in there, we'll track it and give you real-time feedback on it. So as they're leveraging that, what the device companies are starting to do as well is say, well, you know what, we're spending a lot of money on professional education. Why don't we go for the best-in-class professional education? And one of the approaches that we take at Innovis is to act as that really important middleman. So when you look at our segmentation of our market, device companies are very important and growing a huge amount. But we also work closely with the colleges, the societies, the hospitals, the residency programs. And as that middleman, understanding what all the conversations are, we view it as our job to say, look guys, you as a residency program, you've got enough capital or enough budget to get to 70% of where you want to be for ideal training. We also know that device companies over here are investing X amount in exactly the same platform. Why don't we bring the conversation together and start leveraging people's investments so that the value add and the ROI, most importantly for the patient, is even better. So it's spot on. It's a piece that in the UK I think we've done very well, and I think globally as we start expanding, that's going to be something we're going to really focus on.